Okay, wash my hands, knock knock. Hi, my name is Darla. I'm a family nurse practitioner with United States University. Do I have your permission to do a neurological exam today?
Yes.
And then do I have your permission to record and upload this video to YouTube as an unlisted video for my professor to grade?
Yes.
Okay, so I'll go ahead and do a 360 of the room. Oh, today's October 14th, 2024. Exam, we're going to be testing for our level of consciousness. So in orientation, can you tell me your name?
Paul.
Your date of birth?
8/16/88.
Can you tell me what year it is?
2024.
What the date is?
October 14th.
And then can you tell me where we are?
Home.
And what are we doing today?
Examination.
Okay. So he's alert to person, place, time, and event. So he's alert and orientated ×4. He's alert. His speech is very clear. There's no slurring. To test for memory, can you tell me what you had for breakfast this morning?
Bagel.
Can you tell me what you did for the 4th of July this last year?
Camping.
Okay. So he's able to recall remote and recent events, so his memory is intact. For reasoning, can you tell me if you found an envelope stamped and addressed, what would you do with it if you found it on the ground?
Send it to wherever it needs to go.
Okay, perfect. So his reasoning has good judgment, and so that's intact. Okay, so kind of moving on to the cranial nerves. We're going to test for cranial number 1, which is the olfactory, which is spelling. So I'm going to go ahead and I have 2 things here. So go ahead and close one nostril and tell me what you smell.
Coffee.
Okay, and then close the other nostril and tell me what you smell here.
Vanilla.
Perfect. So his cranial nerve 1, olfactory, is intact. Cranial number 2 is our optic nerve. We can first test for our vision. I have our Snellen chart here. Normally we would do this test 20 feet away, but for purposes of this video, we'll do it 6 feet so he can stay in the field. Can you read this line for me with one eye closed?
LTFPH.
And the other eye?
LTFPH.
Okay, so he's reading from the 20/20 line, so his vision is 20/20. Next, we're going to use our ophthalmoscope to kind of look into his eye. We're going to be looking at the retina, the cornea, the sclera. We can notice, obviously, without his sclera is white, cornea is brown. Turn this on. Facing this way, so I'm not out of view. Okay, perfect. Okay, so using my right eye to his right eye, I'm going to shine this into his I'm going to shine this into his eye, find the retina, look straight at me, and look in. And I'm following in to see the structures of the eye, the optic nerve, optic disc, and the vessels in the nerve. And on the other side, same thing. Look straight. My eye. And following in. And again, looking at the structures behind the optic disc and the nerves and the vessels. Okay. Perfect. And then cranial nerves number 3 are the extraocular movements. So 3, 4, and 6. 3 is the ocular movement, 4 trochlear movement, and 6 is the abducens. So I'm going to take my finger, and I'm going to have him follow my finger. Abducens, trochlear, and I'm noticing if there's any nystagmus in his eyes. Okay, perfect. And then far away. has good confrontation. Okay, perfect. So those were cranial nerves 3, 4, and 6. Cranial nerve number 5 is the trigeminal, which is our jawline right here. So I'm gonna have it right here. Go ahead and open your mouth. Close. Okay, that's intact. Good. And then soft. Okay. So moving on to we did 4, 5, 6. Okay, 7 is facial. So go ahead and smile and frown. Blow out your cheeks. And we're just noticing if there's any differences in size and making sure that it's nice and symmetrical when he does all those facial expressions for cranial nerve number 7. Cranial nerve number 8 is hearing, is the vestibulocochlear. A few things that we can do is, number 1, we're going to do the whisper test. So I'm going to close this ear. I'm going to whisper, apple.
Apple.
Over here.
Baseball.
Okay, perfect. Whisper test is good. We have our tuning fork to do our 2 other exams. We can do the Webster test. I'm going to go ahead and prune my fork. I'm going to put it on top, and he's going to tell on top of his head, and he's going to tell me if he hears it in one ear or if he hears it in both ears, and he should hear it in both.
I hear both.
Okay. And then the Rhines test, I'm going to tune my fork. I'm going to put it on the mastoid bone, and he's going to, usually this can last about 40 seconds, but he'll just tell me when he stops hearing it. I'll pull it away, and then we'll bring it back to his ear, and he'll tell me if it is ringing or if it is louder in tone for him.
Mm-hmm. Yep.
Okay.
Mm-hmm. Yep.
Okay. Perfect. Okay. Next is the glossoidal nerve, and which is 9, and 10 is the vagus nerve, and these are allowing us to swallow. How we can do that is see if the patient can swallow. Okay, and then open up and say and then we're just noticing his mucosa, and we're noticing. Can you move your tongue to the left and to the right and up? Okay, and then say again, and making sure the uvula is midline. Okay. Cranial nerve number 11 is our accessory nerve. So I'm going to put my hands on your shoulders here, and you're going to shrug up. Okay, nice and symmetrical. I'm going to put my hand on your chin, and you're just going to, with resistance, you're going to try to move your chin to that side. Okay, and the other side. Okay, perfect. And then cranial nerve number 10 is our hypoglossal nerve, which is the tongue. So go ahead and stick your tongue out. Okay, it's nice and midline. There's no shifting. So those are all of our cranial nerves, 1 through 12. Okay, moving on to our motor. I'm going to go ahead and have you stand up, and we're going to walk right here. Just walk back. Walk. Normal. Okay, and we're just noticing his gait, his stance, if there's his posture, if there's any tics. And then this time when you walk back, I'm going to have you do a tandem walk, which is heel to toe. Okay, he has good posture still, steadiness, he's coordinated. This time I'm going to have you walk, walk on your toes, and then when you walk back, you're going to walk on your heels. And then turn around, walk back on your heels. Okay, perfect. And then now I want you to do just like a shallow knee bend. Okay, perfect. And then go ahead and have a seat back over here. So in this too, we're noticing like his muscle, if there's any atrophy present, which seems to be in good shape, lots of muscular in all extremities. Now we're going to kind of move on to passive range of motion, kind of doing the arm limits here, and then asking, is there any pain when you have any of this? Okay. And then put your hand, try to move your hand up with your thumb, okay? And then your whole arm, okay? And then move out with your elbow, okay? And the same over here. Whole arm, okay. whole arm. Okay, perfect. And then shoulders, elbows. Okay, now knees, go ahead and push against, and again push in. Okay, and bring your other leg around here. Okay, push out and in. Okay, and then knees, and then hips. So go ahead and have you lay down this way. Okay, go ahead and push your leg up, and then press your whole leg with your leg. There you go, and here, and then here. Okay, now bring your knees up, knees together. Okay, I'm gonna put some resistance on your knees. You're gonna try to push them out. Okay, and then push them out and in. Okay, and then this leg down. And we're gonna go do internal and external rotation. Okay, and then push against me, and then push in. Okay, and lay down. Okay, and then push out, and then put in. Okay, perfect. Hips. Okay, and then go ahead and turn around, sit back. Turn around, sit. Okay, perfect. And then now we're going to we can do a few tests to test for our coordination. So go ahead and stick out your hands, or stand up, I'm so sorry. Stand up, okay. And then you go ahead and close your eyes, okay? Okay, perfect. So that test is the Romberg test. Again, testing for rotation. Okay, now go ahead, still close your eyes, hands straight out now. I'm gonna do the same thing. Okay, good coordination with our Romberg, and then that last one was our promotor drift drift test. Okay, so now sit back down, and then I'm going to do our point to nose test. So I'm gonna have you, I'm gonna have my finger out here. You're gonna point to my finger and then put it back to your perfect. Perfect. So those are our motor exams. We test for strength, two for a neurological, because that affects how we move. Oh, and another test we can do is stick out your hands. Sorry, these are fun. Okay, so I'm gonna go ahead and try to separate your fingers for me. Okay. Okay, I'll bring them, and then try to do it again. Okay, and this one, fingers. Okay, and then wrists both out. Try to push them down, and then up. Okay, perfect. Those are fun. I always forgot about those ones. Okay, so moving on to our sensory. A couple of tests that we can do are the Sagmattis test. So I'm going to have you close your eyes, put your one palm out, and I'm going to put something in your palm, and you're going to tell me what it is, okay? Okay, close.
Coffee bean.
Okay, perfect. So he passes that test. And then our Grafficeus test, we're going to go ahead and close our eyes. And I'm going to trace something on the palm of your hand with your eyes closed, and you're going to tell me what you feel.
0.
Okay, and the next one?
V.
Yes, perfect. Okay, so both of those tests are intact. Okay, so now I'm going to have you still close your eyes. I'm going to point to a part of your body. You're going to tell me where I touched.
Arm. Leg. Foot.
Okay, perfect. And then, so point to test. Ending elbows. Okay, so we're going to move on to our deep tendon reflexes. Okay, so starting with our hammer, we're going to do our brachial. So I'm going to have my hand here, and we're going to hit with our hammer and look for movement in this thumb. Okay, and then elbow, I'm going to touch his bicep. Okay, and then tricep. And he's pretty muscular, so hopefully you can see little movement there. Oh, there you go. Okay, and then we would do this bilaterally. Moving on to our patella. So scooch back, make sure there's like, you're not resting. Perfect, right there. Okay, right above the knee here. Perfect. And our Achilles. So hitting the back of the foot here. We're looking for reflexes in the foot here. Okay, perfect. Those reflexes are good. And then I'm gonna have you lay down here. And then for the cutaneous ones, we're gonna do the abdominal one. So I'm gonna go ahead and lift up your shirt. I'm going to kind of stroke above his belly button, and we're going to look for movement along his upper abdominal muscles here. Okay, and he had movement right here, and then right up in here. Perfect. And then lastly, fun one, is our Babinski reflex. So with the end of our hammer here, I'm going to take your shoes off. We're going to stroke the bottom of our patient's heel from the heel to the ball of our feet and look for his, bridge. And then right back here, same thing. Perfect. All right, so this concludes our neurological exam. Thank you very much.